Hello and welcome to today's episode of the Elite Health and Wellness Show. My name's Clay. I'm co-owner of Elite Health Online, and this is Boomer. Boomer's my business partner and co-founder. Boomer, what are we talking about today? We got an exciting topic, I know.
Well, we kind of do. So we're going to talk a little bit about, or a lot about, just an overarching idea of what's going on in today's healthcare market, right? So it's one of the reasons, and I kind of want us to go a little bit into how and why we even started this company, right? We identified a need. I mean, we both have 20 plus years of experience in medical sales and, various aspects of medical. And it was about 5 years ago that we really got serious about something that we saw happening in the market, right? And it was this idea that, providers and not every single one, but a lot of medical providers were kind of switching how they treated patients, right, from a patient perspective to more a protocol basis, right? Which we'll kind of get into a little bit. But I saw, and I think you did too, the patients, and we were patients too at the time. We weren't just in the medical world, we were actual patients of this. Right. We saw this pushback, right? Yep. The patient pushing back going, no, that's not, I don't think this is helping me. Right. And where can I go to get the help that I need? Right. Yep. So, that's what I think you and I both saw. Yeah. We'll talk a little bit more about that. But anyway, that's what I want to go over today, man. How about you?
I agree. I think that the audience would really benefit today from hearing that if you've experienced what we've experienced, and that is that the healthcare system today as a large part is broken. 100%. And it really starts with a couple of stories that we've recently both had. We have several we're going to share today. But I want to share one to kind of tee up the conversation because I think people will resonate with it. Sitting at a Texas Tech football game recently, pre-tailgating, there's probably some drinks being, so people are a little more forthcoming with what's going on with them in their life. And one of our good friends recently watched one of our episodes with Jennifer. And she said, I'm experiencing all of those same things. The problem is that instead of coming to an advanced clinic that's worried about her optimal performance and her health and wellness, she went to her provider. And being this traditional healthcare provider, she mentioned, hey, this is how I feel. I learned about these possible treatments. What do you think about that? And he said, I think you're depressed. I think we should put you on some antidepressants.
Yeah.
And I'm going, antidepressants over low hormones, optimizing your health and wellness. She shared things like, look, I want to be a nicer wife. I want to be a better, parent, but I have no energy and I know that I'm emotional.
And the provider, I'm guessing, I don't know who it was, but probably made this determination without running a single lab panel, without doing any kind of blood draw, just symptom-based alone, saying, okay, you got to be, I can't tell you how many times, I'll tell you another story here in a few minutes, of a patient that we just acquired, actually two patients that we just acquired that have very similar stories, friends and acquaintances of mine that tell me the exact same thing, right? I think we see a lot of that happen. One of the things, though, that I kind of want to start going down is this idea of where we even get this information that doctors and even hospital systems especially tend to use today, right? And, it's disappointing and a little bit jarring to talk about this, but so much of the medical information we have out there in terms of therapies or lab values, it's actually based on a sick population. Yeah. Right. It's not based on a healthy population. Right. For example, I'll give you my own anecdotal kind of experience here. And this was back when I was about 32 or 33 years old, and I felt like I wasn't as sharp and as physically aggressive as I used to be. And so thinking back on it, clearly I was beginning to have kind of the first of my low T issues, right around 32, 33 years old, I think it was. And so same thing. I didn't know a lot about it at the time. Even though I was in the medical world, I didn't know a lot about it. Right. So I just went to my primary care guy that I had had for, 20 years at that point. Right. Good dude, nothing wrong with him. But we go in, he does run some labs, right? And I come back and my testosterone level is at 300. And to me, I don't know much more than to say, well, that seems low. Right. And he looks at me and here's what he says. He goes, no, this is where we want you to be. And I said, what do you mean? And he says, well, no, when we put our men on testosterone therapy, you don't really want to go aggressive. There's really bad science out there that says don't go aggressive. And maybe there is, but he says this, 3 to 350 is where we try to get people to be. And that just, man, he's the doctor. He has the medical degree, not me, but I just intuitively knew that was not right. Right. Yep. Because I'm sitting there thinking, well, hang on. I didn't ask him this, but I left and I'm in the car driving back home thinking, I just don't think that makes sense. Because if I know that at when we're at our optimal level between the ages of 15 and 25, right? Our late teen years, early 20 years, whenever we're just running out there and running the world, and we can eat whatever we want and exercise and stay up all night and the whole thing like that, because our hormones are really operating at their highest that they're ever going to operate at. And if men typically run a level of between 8 and 900, well, why can't I get back there? Why are you telling me 300 is where I need to be?
Why is that optimal?
Right.
That goes back to that. Again, we talked about this on another episode. As a lab professional running labs for first half of my career, we know how normal ranges are established. Let's just take a bunch of men that are between the ages of 18 and 90. Let's run a bunch of tests and let's see what comes back. And if they're all healthy, quote unquote healthy men, they're alive and breathing, well, then that's our normal range. We'll pick something and we'll say the levels from here to here. Right. It does not mean that the man at 25 is functioning the same as the man at 90. So let's not use that as a normal range.
No, let's not. Or what a lot of, and I'll even say labs, and I used to work in the lab industry, where they'll get it wrong is it's still based on kind of an unhealthy crowd, right? Because if we have, and this is really based on insurance will say, hey, you men need to start having annual physicals at the age of 35 or 40. Okay. All right, fine. Well, but if I go in there and have a physical at 40, I'm clearly not as healthy and in as good a shape as I was when I was 25. So you can draw my blood and tell me that that's healthy, but you're telling me that it's healthy or normal, I should say, for a relatively unhealthy individual at 40 years old. Healthy people who feel good don't go to the doctor, right? So we don't have lab values and information based on a healthy 25-year-old. We have it on an unhealthy 45-year-old.
So here's a great example of that. And I think this will be, and I want to get into the why. So maybe you can take this to the why. You and I both know why, but let's share in our expert opinions. And I say expert as someone who walked into doctor's offices for over 20-something years making sales calls. And we understand what doctors intuitively want to do, why they went into the field. And then we also understand their motivation financially. So another female situation, good friend of ours, wife seems premenopausal in every way, that's possible, right? I mean, just all the signs and symptoms of someone who's almost 50, goes to her OB doctor, gets her values checked. This is a place who does hormones, by the way, but it's not their primary thing. It's a side hustle. It's a way in which they make some money on the side. They don't really know that much about it. They're not that trained. Her testosterone's 17.
Oh, wow. Yeah. Almost undetectable.
Now, do you want to hear the really interesting part? The doctor told her, your values are perfect. Now, I don't want to get into the deeper aspects of it, but there's nothing functioning well at 17.
And not just your testosterone. Your testosterone's not the only thing broken at 17.
But let's go over why would a provider have that mentality?
Yeah. That's a good question.
Yeah, I think it's because most providers, and you and I both know one of our good friends and patients, Jonathan, talked about this. He went to his doctor, and they're focused on sick care. If you're not sick, and you don't have a diagnosis, I can put a diagnosis code on, then I'm not treating you.
I'm not treating you. That's right.
And that's often what they look at is you look like every other 50-year-old female that walks in here. That is the lab value that we see. You're experiencing all the things that 50-year-olds should experience when it doesn't have to be that way.
Right.
And to use one of our good friends, Jonathan, as an example, if you remember his story, went to his doctor. Money's not the issue with this guy.
Right.
Not a problem. He says, hey, I want you to run. I had lost a father at 50. I want you to run all these labs on me, and I want to look at my risk factors, and I want to become, to take a, coin Tony Robinson's term, he wants to be the CEO of his own life, of his own health.
That's right.
He wants to gain information, and he says, I want you to run as many tests as you can to give me where do I stand and what can I do to be optimal?
Right.
Doctor said, I won't do that. Why won't you do that? Because insurance will deny it and it'll cost a fortune. Let me know what the costs are. I'll pay for it. Which, by the way, it's not going to cost a fortune. Right. She came back to him and said, I think it'll cost you around $3,000 to run those tests. To which he said, okay, no problem, run them. Her response was, I won't do that. You're not sick. I'm not doing this. You need to find another provider.
Right.
Where did we lose our way in the healthcare environment where we're supposed to keep people well?
That's right.
This is a gentleman who wants to be optimal. He's coming to a doctor to say, keep me well. And she's looking at it as in, I need to get on to my next sick patient.
Right. That's exactly right. Well, and I don't want to kick doctors in the teeth too hard over this because a lot of them do think that way because they've been trained to think that way. Right. I mean, this is what a lot of these medical institutions that are spitting out these doctors on a yearly basis, it's what they're teaching them. right?
Right.
I mean, when medical books are written by pharmaceutical companies, we have a problem
Right.
at that point, right? Because now we're just pushing a pharmaceutical company's agenda. We're not pushing health and wellness anymore, right? We're pushing insurance regulations and guidelines. So, while this doctor that we just talked about with our buddy Jonathan, quite honestly, if I didn't know any better, I would say the reason she didn't want to go any further with him is because she was afraid of two things. One, she wasn't going to get paid for that visit. His insurance wasn't going to pay because she's addressing something that insurance doesn't want her to address.
Right.
And then number two, she's going to get a call from some agency, maybe the medical board, going, you're operating outside of your scope of practice. Stay within sick medicine and don't focus on anything else.
Right. And so again, most providers, and you and I know this from doing some of the consulting we've done with doctors over the years and helping them improve their practice, is the value-based care system. Value-based care is a system that the insurance companies have set up, and now, and they say, okay, doctor, someone comes in with this diagnosis. These are the exact tests you have to run. You need these values back. You need to manage it in this situation. If you do exactly what we tell you to do, then your reimbursement will be X. And if you do that on a consistent basis, your reimbursement gets higher. If you're not following our rules and guidelines on the proper testing and the things we tell you to do, now you've put the doctor in a box.
Right.
And the doctor can't say, Boomer, what's best for you? What are you trying to achieve?
Right.
Your goals are not the same as the other. The other guy just wants to make sure he's not going to die.
Right.
And you're saying, I want to be optimal.
Right.
And that's really where Elite Health Online is different, is that we allow you to be the CEO of your own life.
We do. And it's a great term to use, the CEO of your own life, CEO of your own health, because, I'll tell a couple of examples here too. So a friend of mine, I'll go acquaintance. My friend of mine calls me about 3 weeks ago. She wants to become a patient, and you could hear. I mean, it was audible. You could hear the frustration in her voice whenever she called me. She goes, I do whatever you need. Give me some labs. I want to talk to one of your doctors. Tell me how it works. What do I do? And I'm like, wow, you really seem pretty upset. And she goes, I'm not getting any answers. And she tells me the story, and here's her story. She's about 44 years old. Married, a lot of kids, and she's mainly responsible for her kids. Her husband works hellacious hours. She's very symptomatic. She had never been on any kind of therapy before. Not in bad shape by any stretch. I mean, she works out, and fine. But she just felt very bad. She felt run down. She felt tired. She felt foggy brain. She, her workouts are not as good as she knew that they used to be. And so she goes to her OB, and I'm sure, I don't know the OB. I'm sure she's a great lady, but same thing. She runs some tests. Okay, her testosterone comes back as undetectable. Okay, so every lab has a value where they won't measure below
the detector. Doesn't mean there's not there. It's not detected.
It's just not detected, right? And so, in this first example, same as you said, right? The doctor tells her, "Well, you're experiencing some depression. I'm not worried about your testosterone levels. What you're telling me is you're depressed. Everything you're telling me is depression." And she kept saying, "Well, maybe it is. That's not what I think. Maybe it is depression, but I don't think that's what it is. I don't feel good. Everything hurts, and I'm just not physically able to do things like I used to be able to do." And the doctor basically, on no uncertain terms, said, "Well, I'm not real sure what to tell you, but let's take a look at getting you on an antidepressant."
Yep.
Right.
Yep.
And that's when she called and she goes, "Look, I'll take an antidepressant. I'm not saying I'm not going to, but there's something else there." And she goes, "Whenever I see a lab value that is undetectable, that's a problem," and she's not addressing the problem.
Yeah. So it's so interesting. We've had several people who've listened to previous podcasts, and you made a statement on one. You said, when I first went on HRT, my doctor correctly told me, you're married to two things now, your spouse and your HRT therapy, because we know that the treatments that we provide are not going to we're not correcting the hormonal balance permanently. We're not fixing the issue where your body's going to take over. There is no such treatment.
That's right.
That I'm aware of, or that, and we've been in this a long time. So maybe they'll come up with something. But today it doesn't exist. Right. It's like your vitamins. You've got to get on them and stay on them. And she said it really turned me off when he said that, because I'm like, I'm not jumping on something that I have to take the rest of my life. And I'm like, well, do you take vitamins? And
do you eat every day?
Do you eat every day? And do you take in water? I mean, these are things you need. They're vital for your health. But I'll be honest with you, and you may know more about this, and I'm not an expert on antidepressants at all, but how many patients do you know that get on antidepressants and come off?
Oh, tons.
Come off where they get off of them after a season.
Well, they do, but and there's a lot. I think there's a lot. I know we're not going to go down this road. I know you don't want to go down that, but there's a lot of different reasons too. One of the one of the worst side effects of an antidepressant is how it literally makes you feel. It may be solving a cognitive issue, but over here it's making you feel like absolute garbage in some way.
Right. A lot of ED related issues.
Right.
SSRIs just aren't, in my opinion, they're not great. Right. And I just know a lot of patients that can't seem to ever get off.
Right. Well,
so it turns into not only like a lot like hormones, it turns into a lifelong, commitment to therapy.
Right. To where they think they need it. Right. I mean, or sometimes it's not even. It may not even be like a true antidepressant. It may be like a stimulant medication. So like an ADHD medication of some kind. I mean, Adderall is a huge medication that, in my opinion, is being abused today. Right. How many patients are on that don't need it? Right. When it's really, look, to back up a little bit, it's the aging process is what we're talking about. Because we're not immortal species. We are a mortal human being. We're going at some point in time to die. We're not going to live forever. Yep. And our body knows that. So, as we're young, we're creating more cells than's dying off. And then kind of in the middle between, say, 25 to 40, let's say, it's kind of equal. But then after that, to be a little bit morbid here, our body is kind of preparing itself for the grave a little bit. So we tend to have a little bit more cell death than we do have cell regeneration. That begins with the endocrine system, right? So, and the thyroid, which is part of it. So our thyroid truthfully, our thyroid hasn't functioned properly since we were probably 5, right? Because we'll get into that in a minute. But thyroid, endocrine, testosterone, LH, FSH, all those things that are the precursors to these things, it does begin to trail down and wear off. And so, to your point, that's going to happen. Okay, you have 2 choices. 1, let it happen, don't do anything about it. 2, do something about it, knowing you're going to have to always do something about it.
Well, let's talk about for a second the word anti-aging. So I've had these discussions with family members. Well, are you really telling me that these treatments that you offer are going to extend your life? And I said, no, possibly, but let's pretend that they don't for a moment.
Okay.
How do you feel today? And let's look at the quality of life in the last 10 years. Let's look at the average individual between 60 and 70 and the quality of life that they have. And, my argument is I want 60 to 70 to look the best that it can look, right? I don't want to be limited on what I can do within reason. And I look at people that are undergoing treatment, that are maintaining their ideal body weight. They're doing all the right things. Man, those last 10 years are completely different than they are for some other people. I know you have some experience with family as well, where those last 10 years are not pretty.
Not good. Yep. That's right. Yeah. So. No, it's a really good point. There was a comedian, Dennis Leary, that talked about this, 25 years ago about how, hey, if I'm gonna miss the last 10 years of my life, take them if it's not going to be anything good, right? That's the whole thing. Is look, let's. To make it a little bit more positive, there was a study I can't remember which one it was, but there's a study that shows now that our most productive years are occurring a little bit later than they used to, right? It used to be let's learn everything in our 20s, let's apply it in our 30s and go make a whole bunch of money. Let's make even more money and be really productive in our 40s, and let's think about winding it down and retiring when we're in our 50s. There are several studies now that are showing that our greatest time and opportunity now for productivity is occurring between 50 and 60.
Right.
Okay. And then that actually living out and being able to experience the benefits of that are occurring post 60 now. Right. Man, I don't want to be prepared for the grave when I'm 60 years old. Yeah. Am I going to feel like I'm 20 again and be able to jump up and down and go mountain climbing? No. But I want to be mobile, man. I'm going to have grandkids someday, and I don't want to be confined to a wheelchair sitting on the couch because I can't move, But that if you think about it, that, and my family is a good example, as many are, that's the product of the traditional sick care based medical, that has been in this country now for forever, for lack of a better term.
Yeah, I've had people say, "Well, why don't you just age graciously? Why don't you just accept it?" Well, I'm accepting it. I'm just going to fight the best I can to go.
Well, yeah. Who doesn't want to feel good, man? Right. Here I am. I go to the gym every day, and I know you do too. But at 46, no, my workouts were a lot better whenever I was 26, and it didn't hurt. Afterward, I could recover a lot faster, and yeah, I feel it. Now, there's some joint pain and stuff, but man, I get in there going, wow, I'm doing pretty darn good for 46 in the gym, man. A lot of people can't say that. But a lot of it too is this mentality that age is a number, right? Yep. My parents, they always portrayed themselves as being a lot older than they really were, which kind of gets into the mental aspect of it, right? We're as old as mentally we feel we are, right? But my advice would be don't let any physician or institution tell you that this is just your fate.
Yeah,
you have to do your own research and be in control of your own fate.
And that's where our clinic comes in. So I want to talk a little bit about how our clinic's different.
Mm-hmm.
So a lot of people will hear, well, the very first question they ask is, do you take insurance?
Mm-hmm.
And we say no. And I want to talk about why for a second. I also want to talk about how it's not more expensive when you go to a clinic that quote unquote takes cash.
Right.
So Boomer, you're really an expert in this. And so I'll have you elaborate. But what we do know is that when you take insurance, you're limited in the treatments that you can offer. Again, we're going to go back to the evidence-based medicine. If you don't know what that term is, trust me, that is how your insurance companies and the government reimburses providers. It's how they get paid. If they cannot follow those guidelines and rules and show that they're doing certain things and certain diagnosis codes and then treating according to that, they will not get reimbursed.
Sure.
They need that. As opposed to that, truly looking at what you want to accomplish and then giving you treatment that may be outside of what the insurance companies want to do. And let's be honest, an insurance company does not make money if people are treating for optimal health. They only want to treat when they get to sick.
That's right.
But where we're different is by not accepting insurance, we're able to treat you when you're symptomatic. Let's say a guy comes to us or a lady comes to us and her values are maybe on the line, but she's still symptomatic. There is no magic number. You and I both know there's men who have a testosterone of 600 and feel terrible.
Right.
There's another guy that has a testosterone of 400 and feels amazing. We need to not, and anyone who knows lab medicine, and that's my background again, we are trained and talk to doctors about not treating numbers.
Right.
You treat the symptom, you use the numbers to point you in a direction, but you do not treat numbers. You treat the person. I mean, so much so that if you get a value, you get a potassium value that doesn't make sense and the person should be dead based on the value, and you look at the person and they're not dead, you don't treat them.
Right.
You say something's wrong. And that's the difference in our clinic and the sick med clinics is I cannot treat you because your levels came back
at X. Right.
And that's where we get a lot of patients say, but they'll come to us and say, hey, are you sure you can treat me? Because I feel terrible. I'm looking for a clinic that'll support me, but my doctor told me he won't treat me because my levels are at 600.
Right. That's right. Well, so we know medicine, I think we've overcomplicated it in this country, clearly, right? Because we've allowed other entities to become in control of it. When really medical decisions need to be between the doctor and the patient. And other entities have come in and inserted themselves in between that relationship is where we're going with this. Because a medical provider should be looking at two things, to your point, the symptoms and then the lab values, okay? Based on what the numbers say and based on the symptoms you're telling me, I'm going to prescribe this protocol of therapy for you, whatever that is, okay? Allergies, even if it's something as mundane as that, right? But that's not what happens, okay? The doctor now is mandated, like you say, by things like pharmaceutical companies and insurance companies to go to a protocol base. Well, I hear what you're saying, and I see the numbers, but that's not what this says to do over here. So I have to do what this says to do over here. And now we have a frustrated patient that you're probably not going to hang on to very long if you're a provider. Yeah. Now, if you wanted to get real controversial in here for a second, pharmaceutical companies do not want us to be well. Because let's face it, I mean, if they develop something or even, something as mundane as a medication, okay, to make us better and more healthy, well, they're eventually putting themselves out of business if we're healthy, right? So that's not what they want. That's not the point, which is why, again, we say you have to take control. You have to be the CEO of your own health. And don't confuse pharmaceutical companies with pharmacies. Right. Pharmacies, especially compounding pharmacies, can do a fantastic job of prescribing, or not prescribing, but creating the right medication for you and the right product for you to where you can feel at your optimum level whenever you're 45, 50, 60 years old even, right? Yep. So, that's primarily going back to the insurance discussion. That's why we don't do that, because we don't want insurance companies to tell us how to or tell our providers how to treat the patients. Right. We want the provider to make that choice. And at the end of the day, it's kind of funny how the finances work out. It ends up being the same out-of-pocket cost, or sometimes even less, to be totally honest with you.
I want to run those numbers for the audience and kind of share some of that, but I want to make a relation. A lot of people respect Tony Robbins. I mean, the guy can't take away from what he's achieved. And in his book, Life Force, he tells the story right out of the gates of he went to a doctor, and based on his size and stature, the doctor said, you may have a tumor on your pituitary. I mean, he's a huge guy. Turns out he does. So it's a great diagnosis by him. But the doctor said, I need to operate on you. And if we don't operate on you in the next 48 hours, you could die. We need to do that. I mean, you have to go listen to the story. The point is, Tony was smart. He said, I'm CEO of my own life. Hold on. How long have I had this tumor? Now I'm going to die in the next, if I don't get this out in the next, couple of days, hang on. I'm going to get some other opinions. Became the CEO. He's going to check now. not just because my doctor said.
Right.
So he goes on this health, this journey of going to different doctors. And I think over the next year or so, he went to a number of doctors. I don't remember the exact number. But one of the doctors gave him several gave him treatments that could paralyze him. One of the treatments years later turned out to cause other cancers. One doctor told him, you could have had this tumor your entire life, and it may not be moving one butt, and it may actually be giving you all the because it was producing more growth hormone, something people pay
It's very beneficial.
hundreds of dollars a month
Sure.
to get.
Sure it is.
This may be why you're so young, energetic, and doing the things you're doing at your age, and people pay thousands of dollars to have what you have. But if that tumor is not growing and moving, we need to do nothing.
Right.
And he's done nothing now for over 10 years except for monitor the growth. He's not having brain surgery. He's not undergoing any risky treatments because one doctor, but he had to own that.
Right.
He had to go out and pursue truth and figure out what makes sense to him. And there's a little bit of risk in that, but there's a whole lot more risk in putting all your chips on one doctor and saying, I'm going to trust what he says. And we have, some examples of some guys we do business with who have been going to endocrinologists for years.
Right.
They're not managing their weight.
Nope.
A1C's off.
They want you sick.
And
they actually need you sick. I'll tell not to interrupt, I'm going to tell a story I've told you before, but it's probably one of the most disturbing stories that I've ever told, but certainly the most disturbing scenario I've ever encountered. And this was back in my medical sales days when I was focusing on products related to, glucose, but specifically A1C and diabetes. And I was talking to an endocrinologist out there, kind of in the West Texas area. And he's not really giving me much feedback, which is, we're sitting there and I did the whole rep thing, right? I brought in the lunch and we're sitting there, we're talking, the staff comes in and we're kind of talking about our families and what we're doing over the weekend. Then we get down to business and this doctor, and I won't mention his name, but he just kind of shuts off and stops listening to me, and I'm just kind of going over all of my stuff and reading everything I'm supposed to be reading off. And then I'm trying to make it more conversational, add some humor. So maybe I can kind of engage him a little bit. And finally,
you encroached in on something that was going to change his model.
Well, yeah, he was just interested in what I brought for lunch. He wasn't wanting to talk to me, and it was kind of making me a little bit mad. I'm like, man, I drove all the way out here and I did this, and so I just stopped and I said, Doc, is any of this getting through? I mean, are you? And I just asked, I said, are you listening to me? And he looks up and he says, let me tell you something. He goes, if I cure or prevent diabetes, I go out of business.
Yeah,
and he left the room. And this is an endocrinologist that is supposed to be tasked with getting patients through their diabetes, off the diabetic medications, get your A1C down. I guess I can consider it very fortunate that I had that level of transparency because it opened my eyes to how a lot of these people really think.
Yep. I mean, I remember just working at Children's Medical Center when it was slow, man. I mean, we didn't want ATV accidents, but we have to send people home if we don't have accidents.
That's right.
You don't wish on accidents, but I think that's where doctors really are at the end of the day. It's a conflict of, I've had family members who recently had cancer. You're really you're past the age of going through treatment, going through chemo a second time. But I don't make money if I don't put you on chemo.
Well, that's
doing
right.
nothing and letting you, have surgery and living your last few years out and seeing what happens is probably the best course of action. Gives you the best lifestyle. But I don't make my bills if I don't put you on chemo.
Well, I'll give a very personal example. I've talked about my dad before and how he lived with a very debilitating disease for the last 14 years of his life. Really the last, I would say, 5 years of his life were really awful for him, bless his heart, and for us, the family, my mom, who was his 24-hour-a-day caretaker. It was getting more and more difficult, more and more expensive too. And, his neurologist kept putting him on these medications that wouldn't do anything to necessarily treat the condition because it was actually beyond treatment. But they were just prolonging his life, which is not a bad thing, and I'm not saying that. But if my dad were sitting here right now and he could answer the question, he would say, you know what? I would just have rather gone.
Yeah.
Forget those last 5 years. Forget the last 10 years. I don't care. I had no quality of life whatsoever, and I'll just go 10 years earlier. Not that that's going to happen on therapy, but that tends to be, we got to get the longevity numbers up. So let's just keep people on medications that's going to keep their brain functioning and their heart functioning, but there's no quality of life in that, which is why, we've seen over the last few years, the doctors that really do want to make a difference and they really do want to help people, they get away from the insurance model. They get 100% away from it, and you and I know a guy out in Forney that did that years ago. He was board certified internal medicine, took the insurance route, but knew intuitively that there was just something wrong with that. And he completely switched his clinic from overnight, from insurance to cash base. And he's bullish about his cash. He's he doesn't give a lot of discounts because he doesn't have to, because he was the first one. And the reason I bring him up, he was the first one to open my eyes to this concept. And he said, what I've noticed in my practice since I switched is this. If I tell my patients that I accept insurance, they want insurance to pay for everything at that point. And they fight me on a $30 copay. But if I tell them, I don't accept your insurance, that's great. Glad you have it. But this is a cash pay. They go, okay, how much is it? And they pay. And now he can treat patients. Now he can do what's right by that patient. So, I know there's a lot of other outfits out there that do what we do. And one of they think they're advertising by saying they accept insurance.
Yeah, that's terrible.
I'd stay away from them all day long.
Let's dig into that. So I really want the audience, if anyone's out there that's interested, you're either going to an insurance-based clinic today, or you're considering and you're saying, I have insurance, I pay for insurance, I'm going to find me an insurance-based clinic. I think the goal we want you to understand today is that you don't have to go to that clinic and receive subpar care. Don't look away from a clinic like ours, specifically Elite Health Online, that does not accept insurance. And what I want to kind of help the audience with is some of the numbers. So let's take our big competitor here, Low T Center, for example. I'm sure they'll love this, but let's expose this a little bit.
Yeah, let's do it.
So not only is it super inconvenient, I've got to come into their physical clinic, whereas it's not online, and I'm going to let them give me a shot every single week.
And gas is $4 a gallon to get there.
And I'm a busy guy, busy lady. They're also going to charge me a copay. So I'm going to pay, $20-$30 a week. Okay, that's 4 to 5 times a month, right? Every single week, you got to have a shot. And they're going to run it through my insurance. Okay. And then there's still added charges like labs, and then I got a lab copay. So Boomer, you're pretty quick at math. What are we talking about per month for basic testosterone therapy at a Low T Center when you get all said and done out of your out-of-pocket costs?
Well, your out-of-pocket costs, if you factor in your copay, you factor in the membership they're going to make you get into, and your lab costs, you're easily, if you did the math and really looked at your credit card bill, over 300.
Let's go to the low side though. Let's even say, I have guys that say, I think it runs me. I'll ask them, and I think they're pretty accurate. They'll say, I think for the basic stuff at Low T Center or wherever they're going, name your generic, Walmart type place for it. It's $150 a month, Clay. That's what I pay.
On the bottom side.
Easy, but that's for the basic stuff. And I'll go, okay, well, why have you not explored our clinic? Well, you guys don't accept my insurance. What if I told you, though, that it was $120 a month cash?
$30 less and you get more stuff.
But you're not using my insurance. I'm like, what do you care?
Right.
Well, because we're not filing all the paperwork and we're not having to jump through the hoops, do the extra lab work, and do everything else, we can do it way more affordable. And I think you've done some numbers. You and I've talked about this in the past. They've done a lot of research. The average individual is willing to come out of pocket for wellness and health-related, expenses. A number, and there's been a lot of research going to that number.
Yeah, so we did this through another entity not a long time ago, it was just a few years ago, but we paid for a study. It was a very expensive study. So this is not us coming up with the numbers. These are actual numbers from actual physicians and clinics across the United States, and we surveyed about 500 of them. And what we found, and we had a specific number or a set of questions we wanted them to answer, but the one that I keyed in on the most was, what is the average patient willing to pay if they came to your clinic 4 times a year? Okay, out of pocket, with insurance,
cash.
Okay, cash, right? This is why we have deductibles. The number was $575. Across the board, the average was $575. So what that means is that a patient is willing to come out of pocket $575, even though they have insurance, to come see a wellness or really any clinic, 4 visits a year. Well,
that's $2,000.
That's $2,000. Right. Okay, actually, it's a little over $2,100. If we look at it this way, what's the average deductible on an insurance?
$30, $40, $20 to $30.
But out-of-pocket cost throughout the entire year is going to be over $2,500, right? So the insurance...
Well, you're going to get one lab test a night. That's
right, you're going to get one, and you're not going to get any more.
We went through this experience in some consulting we did. We had patients come in and say, but you guys charge cash. You want me to pay for my labs, which, by the way, labs are free now at our clinic because we wanted to overcome that hurdle. So we absorbed that as part of our marketing expenses. But they would say, you're making me pay for labs. Like, yeah, but if you get a free one for your insurance, your company's
Primary care
insurance,
guy,
whatever.
let's say. Right.
They'll run a panel, but you got to have 2 a year to be on testosterone replacement therapy and wellness. So the second one, and we went to our lab company and said, run us the last 3 years. What did the average person pay for labs this year?
$260 per lab panel.
Exactly. So now, or you could pay $300 cash, never have to do the insurance, do anything. And we, of course, made that at Elite Health Online now completely free. There are no lab costs. We absorb that as part of the absorption into the clinic to take that barrier away. That's not something that's offered. But your point, if you go to low T centers and these other clinics, you're going to pay for labs, and then you're going to end up coming out of pocket for one of those because you've exceeded the number of lab values being run through a year.
And maybe as per provider, there may not be a set standard, but most providers and most kind of, shot spot clinics like we're talking about, they're going to want labs monthly or every 3 months or every 4 months or, probably more than twice a year, which is all we require. Look, I mean, labs are not fun. Who wants to go get their arm poked and have blood drawn and take time out of their day? Nobody wants to do that. We don't have a better option right now, right? So I get it. I get it why it can be a barrier. It can be expensive with that, but we've taken that expense away because we don't want that barrier there. I mean, look, I can't do anything about the fact that it's inconvenient and you got to go to the draw station. I wish I could solve that problem. Maybe one day we can as medical technology gets better. For right now, that's what we do. But we've at least removed the cost barrier.
So for our patients, no lab cost, no visit cost. There's no copay involved. You simply pay for medication management, shipping, and delivery, all wrapped up into one fee. And it's actually cheaper than if you file an insurance. And the crazy part is what our clinic offers that most don't is it's also a 2-time-a-year consultation. And when people hear a cheaper price, they'll often come and say, hey, I've been shopping, I'm looking around, and I found this clinic, and they're a little cheaper than you. Okay, tell me a little bit more about that clinic. Oh, I come to find out they want quarterly visits. You don't need quarterly consultations unless you're having a problem. That's just a money grab to say, I want to run some more labs on you every quarter. Nothing's changing that frequently. Your PSA, even if you had an elevated PSA, you won't do anything. You're going to monitor it for another 3 months. So a PSA 2 times a year is plenty. Anything more is a money grab. And so that doctor is just going to set up a system to make it less convenient for you and figure out a way to get the same dollars but make it appear cheaper.
Well, and truthfully, what they're going to do too, especially on the insurance side, and I'll keep harping on this, is, they're going to go really conservative, really safe and conservative with your therapy, which is not a bad thing from a clinical standpoint. But the reason they're doing it is because they know intuitively that eventually they're going to have to submit one of your lab panels to your insurance company for continuity of coverage, right? When your insurance company sees that your testosterone's at 400, which I would argue is not therapeutic, they're probably not going to agree to cover it anymore at that point because they're going to consider that to be above the norm.
Low.
They're going to want to see that it's continually low. Now, there's ways to manipulate that, but that's not necessarily doing you any good from a health and benefit standpoint, when you factor in the cost, you factor in your copay, you factor in what you're going to have to pay for labs, and you factor in your deductible, I would argue that we are either right in line or even a little bit below that cost. And I'll tease this a little bit because we have something really cool coming up in a couple of months where we can take that cost now and make it even a little bit less. We'll get into detail about that in a future podcast, but stay tuned because that's going to be really exciting for everybody to hear. One other comparison, though, going back to what you said a second ago, is this idea that, well, you guys are a little bit more expensive. Well, I would argue that we're not, and here's why. Because if you're telling me that you go to XYZ clinic and they're only charging you, call it $100 a month, okay, which, by the way, is very inexpensive for an HRT therapy, what are you getting for that $100, right? You're probably getting just an average baseline basic therapy of probably testosterone and maybe something like an anastrozole blocker. And that's all you're going to get for that cost, okay? We have developed a program to where not only are your labs and consultation free, you can get a full line of HRT therapy. You can get your testosterone and your anastrozole and your nandrolone and your oxandrolone and your CJC and even ED medications, glutathione, wellness, Myers cocktail. And you're still, within that $100 to $130 range per month if you average everything out, right? That's one of the things that I don't, we need to talk more about that because that's one thing that I think a lot of patients don't understand is what they're getting for the value of their dollar when they come to us.
And time is money. And so with that, I think hopefully today what you guys have learned is that the healthcare system, the traditional healthcare system, there's not to say that your doctor is that you're attending is not very knowledgeable about sick care. But if you're talking about taking your health by the horns, you're taking control of it yourself and managing your own health and going on a journey of actually learning and discovering what's best for you, then I would encourage you to check out our clinic at elitehealthonline.com. Research the therapies that we offer. Research getting some lab work done with us. Again, the consultations are 100% free. Lab work is free. All you pay for is medication management, delivery, and supplies. It is extremely affordable. Appointments are once every 6 months. If you need additional consultations or to talk to a provider, we provide those at any time. We can run additional labs if needed, but we run really a clinic that functions on 3 things. One is super convenient. We want to be the most convenient clinic anywhere. And by doing it 100% via telehealth, you can be in your car, you can be at a ball game, you can be in your office, anywhere you want to be, as long as you can take the phone call. It's super convenient, and it's only 2 times a year unless you have a problem. The second thing is we're the most comprehensive, meaning, as Boomer mentioned, we do everything from HRT therapy, weight loss, wellness, and anti-aging, things like liquid readers, sexual health, Myers cocktail treatments to help you stay, well in the flu and cold season, you name it, we've got it. And then it's progressive. So when I say progressive, the real difference in a progressive clinic is a lot of these clinics will just give you enough to kind of get you out of the ditch. It's really not enough to make you optimal. That's right. And the difference at Elite Health is whether you're a performance athlete, a weekend warrior, or just a mom or dad who wants to feel their best and be able to perform at work, you want to be at your optimal level. And we will put you at optimal levels, not what insurance or other government agencies have said this is what they consider the normal range. We're going to let our providers decide what's best for you based on your goals and objectives. So at Elite Health Online, we allow you to be the CEO of your own health. I invite you to click and check out our link at elitehealthonline.com. If you need more information and want to talk to someone, click on Speak to a Specialist. There's a button there that you can click and talk to. If you're ready to book, click Book Telehealth Appointment. From there, you can simply pick your date and time that you want the consultation. A lab requisition will be sent to you. Go to the local LabCorp. They're everywhere. Simply go to labcorp.com and you can find the one the closest to you. Have your lab drawn, and 72 hours later, medication is going to show up at your door. And you can get started on living your best life. So enjoyed it today, Boomer. Anything to add in parting?
I'm going to say one last thing and then we'll get out of here. It's something I tell my son all the time, is that you have to advocate for yourself. There is nobody else in this world that's going to care about you like you do. Yeah. Nobody else is going to help you because, quite honestly, nobody else cares, right? You have to be your own advocate. So that's what I want our patients to take away from today.
Absolutely. Thanks for joining, and we look forward to seeing you on future broadcasts.
Thank you.